Hello and a very good day to you again. Once more, I hope that you had a good week, that you are feeling good, that you are exercising as we have spoken in the past, that you are trying to push yourself a little bit, even if it is hard, that you are eating well, hydrating, sleeping properly, and that you are helping your body rebuild itself and heal faster or better than it would without your exercise and your support. Today, I would like to talk about having patience as patients. I had three more friends and neighbors who were diagnosed with cancer in the last few weeks, very recently. And every time I speak with somebody who was diagnosed or who is diagnosed, the same questions are coming. Says, how do we proceed? Why does it take so long? Because, of course, when we are diagnosed, that is the beginning of a long story. We have to go through further tests and potentially more biopsies and more PET scans or MRI or any other type of tests. All of us have gone through that. And from the moment we are diagnosed until the medical groups, the oncologists, the doctors, the radiologists decide jointly what to do, it takes weeks, sometimes months. So all of us have been diagnosed at some point. We know that we have those cancer cells or those tumors growing within ourselves. And of course, we would like to proceed with treatment as soon as we can to get rid or reduce those cells growing within ourselves. But it is definitely a fact. I call it patience 101. And in my case, as well as in the case of many of my cancer partners, it really takes time. It takes several weeks until further tests are done. Then, in many cases, we like to have a second opinion. And then we need a few biopsies, maybe more tests. We have to look at that. Then we have to decide about the first treatments. And the first treatments, whether it is surgery, chemo, radiation, again, takes time. In my case, it took about 2 months before we decided on a surgery, the initial surgery, and then the surgery was scheduled about 6 weeks down the line because things have to be prepared and more tests have to be done. And every cancer is so different. Where is or are the tumors and how deep and around what other areas of the body. So this takes time as a first step. The same thing with radiation. It also takes time to decide to finalize what type and how to do it. So that is one fact that we have gone through, we have to be ready for, and that many, if not every cancer patient has gone through the patient component. It takes such a long time until things are taken care of because it is so complex. I actually had a discussion about that with my oncologist and the radiologist, who actually became friends after a couple of years of working with them. And they explained a bit to me the complexity of the treatments. We, as patients, we see in many ways the tip of the iceberg, but the iceberg is wide and deep. If it is chemo, for example, there are so many kinds of chemos, the chemicals that are used, and the dosage, and the quantity, and the space, or the space time between every treatment, and so on. In my case, my first surgery as well, depending on where the tumor was, will it be robotic or not, and how many other nodes around the main tumor will have to be taken away. So very complex. And once again, we need a lot of patience. I like the example of radiation. We know that radiation is definitely complex, and the radiologist working with the oncologist have to work on so many different aspects. And just to set up the program in the radiation machine for every patient requires adjusting literally hundreds of parameters. There are dozens of medical decisions, and each decision generates hundreds of checks of technical calculations. The total radiation dose, the number of treatment fractions, the dose per fraction, the minimum dose covering the target, the hotspots, whether different areas of the tumor or surrounding the tumor receive different doses, then the protection of structures, the nearby organs have to be taken into account. So the maximum dose, the mean dose, the specific percentage of each organ, the volume received by each organ, and then again from the maximum dose to the minimum dose, a prostate plan, in my case, apply several separate limits with the bladder, the femoral head, the penile bulb, and several other target areas around it. So the number and directions of the beams, the beam energy, the beam intensity, the dose rate, the position, the angle, the number of control points, the treatment time, how long, how many seconds every beam will go in which area. It is super, super complex. And of course, they take into account the type of tumor, the tumor depth, the shape of the tumor, the anatomy of the patient, how much body fat the patient has, the organ movement caused by breathing or bladder filling or digestion. All of this is taken into account when setting the machine, setting the program for every single patient. Does the patient have implanted devices? Again, the body weight, the imaging and alignment. So those are all elements that the radiologists work on together with the oncologist. And in my case, it took about 6 weeks from the time we decided, about 6 months after my surgery, that we needed 38 radiation sessions. It took 6 weeks for the team to calculate all of the points we just mentioned and many more until the machine had a program, Henry, And every time I showed up at the machine, on the screen above the machine, there was my name, my date of birth, and then the machine automatically started along my own very individualized, very tailor-made program. And again, those machines are so sophisticated. One time, I think it was radiation session 17 or 18, I moved a little bit. Maybe I moved 2 centimeters, 1 inch. The machine stopped because the machine sensed that my body was not anymore in the right position and there was a risk to touch different parts of the body. So again, the medical world is incredible. They do quasi miracles every day, adapting to every patient, adapting hundreds, if not thousands, of different specific markers and conditions for each of us. But it takes time, and we have to be patient, knowing that they are doing incredible things. They are preparing the background. So, in a way, waiting a few weeks or in most cases several months, it is almost stepping back a little bit in order to jump better, faster, and higher. So I just wanted to say that patience is critical. And again, this friend of mine who was diagnosed last week was telling me, I hope I can start with chemo or radiation by Monday. I explained to him that yes, we all went through that. We all wish we could be doing that, but it is super complex. So in the meantime, and as we know that, I wish you all the best. And as always, you keep in mind that you are like a candle. You can light up many, many more candles without losing any of your brightness. Until next week, I wish you health and happiness. Thank you.